Mucinide venom, we think, is even more toxic than Atrox venom. At one time that was considered the same species. Some powerful anticoagulant properties in this venom, and from our first-hand knowledge, it's a pretty serious little venom.
Typically, when we talk about venoms, we don't want to take it to a level of complexity that is no longer interesting to the average individual. You know, if we use that word cardiotoxin or we use that word cytotoxin, or we try and explain it, but we try and do so where it's interesting. It's not, what?
You know, first of all, there are like 5 families of venomous snakes, and each family, have their own spectrum of venom and clinical effects. The elapids, for example, are generally neurotoxic snakes. They cause death by paralyzing the respiratory muscles and you can't breathe. Viperidae is another family, and generally their venom produces local tissue injury, and you can have necrosis and loss of tissue, as well as impairment of blood clotting.
We try to steer away from the old columns of hemotoxic, neurotoxic. And what we typically try and do is explain that in fact many venoms have both neurotoxic components or hemotoxic components or cytotoxic components, to simply say that nothing is quite so cut and dry.
Rattlesnakes are interesting because they do show tremendous variation in their venom. We see the variation in various components. It's not just a single one of the 100 or more proteins in a venom that varies. We see it across the board. We see it at a geographic level within a single species, where the venom in one part of the range can be very different than that of another part. Even within a single population, we see remarkable variation. Some snakes have this, some snakes have that. Even within an individual, when the rattlesnake is born, its venom is typically more toxic. And then as they grow, it becomes less toxic, and they have different components that are changing their relative abundance in the venom. So you have variation at the geographic level. You have it clear down to the individual level. It's really quite remarkable.
With mamba bites and some of the other snakes that people used to think don't cause much tissue damage, like some of the taipans and stuff like that, the people died before they got the tissue damage. And so that's why the myth that there won't be any tissue damage comes from. You know, there can be tissue damage from just about any snake because snakes have enzymes in their venom, some more than others. You know, that it is rare with mambas to see a lot of tissue damage. It's very rare, especially with blacks. But with greens, it's not that uncommon.
We're even interested in neurotoxicity. Mojave toxin is well known from rattlesnake venoms. We see it in the southern Pacific rattlesnake here in California. We don't know how widespread it is yet. And there may be some unidentified neurotoxins, which we're very interested in.
In a given snake venom, we will see all of these multi-systemic things happening. We may see neurotoxins that are impacting your ability for your nerve cells to communicate with your muscle cells. Consequently, we wind up with flaccid paralysis. You cannot move your limbs. Your blood pressure is beginning to fall. You're having difficulty swallowing. You cannot keep your eyes open. And you're beginning to have difficulty breathing. At the same time, other components in that same venom may be in fact destroying the cell wall around your blood cells, may be in fact destroying part of the wall of your muscle cells, may be in fact introducing things into your bloodstream like fragments of fibrinogen, consequently clogging up your kidney's ability to filter your blood. And all of a sudden, we're beginning to see a cascade where you're experiencing renal failure, where your liver enzymes are going off the charts, where we're beginning to see hemorrhaging. You're bleeding from your mouth, you're bleeding from your eyes. We're beginning to see blood in your urine. We're beginning to see blood in your vomit. The polarity in your heart muscle is beginning to be impacted so that you're seeing arrhythmia. All of these things can be happening simultaneously in a given envenomation. And you can begin to understand that the complexity of those liquids falling from that snake's gland are far beyond the classification of a neurotoxin or a hemotoxin.